Hello viewers, I am Dr. Shaileshkumar Garge. Today we'll see which food will benefit or which food can help you if you are suffering with the enlarged prostate, that is benign enlargement of prostate. So in our in the list, first thing is the garlic and onion. So garlic and onion has three main properties, like they are anti-inflammatory, antioxidant and anti-cancer properties. So because of these three important properties, they reduce the inflammation in the prostate. Because inflammation is reduced, the prostate size shrinks and your urine flow will improve. The next food which can help in the prostate is green leafy vegetables. So cruciform green leafy vegetables, they contain DIM, which is a very important content. In this DIM helps to clear the bad estrogen, and bad estrogen, we know that it will have a increasing effect on the prostate. So prostate enlarges because of the estrogen. So this DIM will clear the estrogen, will ultimately shrink the prostate, and your prostate symptoms will improve. So third in our list is tomatoes. So tomatoes, they contain lycopene. Lycopene is a very important ingredient in the tomato, which will inhibit the prostatic epithelial cells. So once the prostatic epithelial cells, they reduce or they decrease in the number, the prostate enlargement stops or the prostate shrinks. Especially in this tomatoes, when they are eaten after cooking, because of the heat, the lycopene in the tomatoes, they increase in concentration, their bioavailability will increase, and this will be more beneficial if they are eaten in cooked. So this lycopene along with the tomatoes, they are also found in these few foods like asparagus, papaya, grapefruits. So the next food is orange and lemon. Orange and lemon contain, these citrus foods contain vitamin C. Vitamin C has anti-inflammatory property, which will reduce the inflammation in the prostate, and ultimately they shrink the prostate. So your urine flow in the enlarged prostate will improve. So the next food is nuts and seeds. Nuts and seeds like cashew nuts, almonds, pumpkin seeds and walnuts, they contain zinc, and zinc plays a very important role. Normally the prostate has certain amount of zinc, but in the enlarged prostate, that is BPH, because of the enlargement, the prostate concentration reduces, and the hormone, the 5-alpha reductase, keeps converting the testosterone from dihydrotestosterone. That is the potent form of the testosterone, which will increase the prostate cells, which will multiply the prostate cells. So this zinc, because of the reduced concentration, cannot inhibit the alpha reductase, and ultimately the prostate dihydrotestosterone increase. So nuts which contain the high zinc like cashew, almond, pumpkin seed and walnut, they increase the concentration of zinc, and ultimately they have a positive effect on the prostate size. Next food or nutrient which can help in the prostate reduction is the green tea and hibiscus tree. So this green tea and hibiscus tree have a specific polyphenols, like in particular EGCG, which inhibits the 5-alpha reductase. So 5-alpha reductase, as we spoken, that they convert testosterone to more potent dihydrotestosterone, which will increase the tells. So once this EGCG will inhibit the 5-alpha reductase, our prostate shrink, and you can have the symptomatic benefits of the BPH symptoms. The next food which is important in our list is the Brazil nuts. So Brazil nuts, they contain high concentration of selenium. So selenium reduces the risk of BPH and prostate cancer. So selenium containing Brazil nuts are important food in our list. Another food is coconut oil and saw palmitate. So coconut oil, they contain monolaurels. These monolaurels, they are a concentrated form of the lauric acid. Lauric acid will inhibit prostate enlargement and improves the urine flow. So when you are cooking food in the different oil, so try to replace it with coconut oil once in a while, so that you will get the adequate levels or adequate quantity of lauric acid. Another food in our list is vitamin D supplements. So vitamin D supplements, naturally you get from your sun exposure, you're walking in the sun, so sometimes that may not be sufficient. So supplementing the vitamin D from the external source, maybe in the form of tablets or fish, or I don't recommend the other form of vitamin D like dairy products and animal source, because that will have a bad effect on the. So plant-based vitamin from the sun and also from the fish. So these vitamin D, they go and bind to the vitamin D receptors which are in the prostate and will help to cause the prostate to shrink. So vitamin D supplements are very helpful in our list. Last is the fatty fish. Fatty fish, sometimes they have there is not much of the conclusive evidence that fatty fish containing the omega-3 fatty acids like salmon and mackerel, these can have a positive effect on the prostate size and prostate cancer, but there are not much of the evidence, because there are some research or publications where the fatty fish containing the omega-3 fatty acids are actually causing or actually increasing the risk of prostate cancer. But these are the list which can help you in symptomatic benefits of the prostate. If you are feeling some symptoms like difficulty, urine, urgency, those may improve, but this food may not reduce the prostate or size shrink to its normal, because every human body is different. So sometimes this food can benefit one patient, may not benefit the other patient. But if you are suffering, because these prostate patients are elderly patients, they might be having diabetes, hypertension, some other risk factors. So when you are trying to change your diet, it's always good to consult your physician or doctor before making a significant change in your diet, because you may try to improve the prostate symptoms but can adversely affect the other diseases like diabetes and hypertension. So be careful when you are making changes in your diet if you are already suffering or having a high risk of other diseases. So I hope this diet or this list of foods can help you improve your symptoms. Thank you.